Linkage to HIV care. Linkage to HIV care is an important early step in successful HIV treatment and a main pillar in the HIV care continuum. Linked to Care measures the percentage of people receiving a diagnosis of HIV in a given calendar year who had one or more documented CD4 or viral load tests within 30 days of diagnosis. Services associated with Linkage to Care play a major role in individuals living with HIV being able to start their treatment and work towards remaining in care. Early Linkage to Care has shown to improve health outcomes for individuals living with HIV, allowing for rapid antiretroviral therapy initiation and the opportunity to reach viral suppression by having an undetectable viral load. An undetectable viral load occurs when an antiretroviral therapy has reduced the amount of HIV in a person to such small quantities that it can no longer be detected by standard blood tests. People living with HIV who take medicine as prescribed and get and keep an undetectable viral load have effectively no risk of transmitting HIV to their HIV-negative sexual partners. For those reaching viral suppression, the science is clear. Undetectable equals untransmittable. Linkage to Care success rates. The United States federal benchmark for the Linkage to Care goal is that at least 85% of persons with a new HIV diagnosis are linked to HIV medical care within 30 days of diagnosis. According to the CDC, of those who received an HIV diagnosis in 2019, 81% were linked to care within 1 month. Delayed linkage to care. Studies have identified several factors that play a role in delayed linkage to care, including but not limited to psychosocial, emotional, and structural barriers, poverty, housing insecurity, lack of insurance or access to primary care prior to HIV diagnosis, substance use disorders, and mental health conditions. People living with HIV more often reported psychosocial issues such as fear of people knowing their diagnosis, concern about medication side effects, stigma, and shame as the most important barriers to care. Other barriers, such as inconveniently located medical services, appointment wait times, and language barriers, also contribute to delayed linkage to care. In 2015, an expert panel from the International Association of Physicians in AIDS Care published evidence-based recommendations for improving the HIV care continuum and linkage to care. Those recommendations include immediate referral to HIV care following an HIV diagnosis to improve linkage to antiretroviral therapy, use of case managers and patient navigators to increase linkage to care, proactive engagement and re-engagement of patients who miss clinic appointments and/or are lost to follow-up, including intensive outreach for those not engaged in care within 1 month of a new HIV diagnosis, and transportation support for persons with HIV to attend their clinic visits. With the work of local clinics, HIV service organizations, hospitals, and primary care physicians, we can address the barriers that individuals face when seeking treatment. As a major pillar of the HIV care continuum, linkage to care programs and services continue to push us towards our national goals for reducing the rates of HIV infections in the United States. In our next video, we will be discussing linkage to care services at Unified HIV Health and beyond. For more information about the HIV care continuum, visit cdc.gov or hiv.gov. Are you looking for linkage to care services? Visit us online at miunified.org or call the Michigan HIV STD Hotline at 1-800-872-8255. 2437.